Let's take the example of testing. You cannot get a test in government hospitals unless you have a cough, a fever, travel history, contacts. I mean, there's a huge list. But if you can afford it, and you can go to a private lab, you can pay about 50 euros and you can have a test quite easily. So what I'm worried about is that in countries like India and the developing world, we're going to see a situation where the rich and the well-off will be able to save themselves. They will be able to get tests. They will be able to access healthcare. But the poor, the migrant workers on whose backs these economies have been built, are not going to have any access to care at all.
Well, this is, it's very interesting what Mandakini has described, because this is one of the issues which is already coming out of this crisis. It's the spotlight on social inequality. Look, in France, what we see is that well-off people like me can work from home and live in comfortable apartments, while the people who are on the front line are daily workers, you know, not only health sector workers like nurses and doctors, but you know, cashiers of supermarkets, people who collect the rubbish in the streets, you know, all these workers that we don't, you know, so much pay attention to because they are so much part of our everyday life, but they are out in the streets, obviously the police force, all the security forces. And we discovered that, you know, our livelihood depends on them at the moment, and so many of them don't have the necessary protections again against the disease.